Lister's tubercle. So just below the yellow dot, what you see is the Lister's tubercle. So from the Lister's tubercle, if we go towards the radial side, and this is the ulnar side. So what you see in the screen, right side of the screen is the radial side, and left side of the screen is the ulnar side. So this is the thumb. So this is the radial side. This is the little finger. This is the ulnar side. I am just at the level of the Lister's tubercle. So this is the Lister's tubercle. Radial side. This is the ulnar side. Here we can see from the Lister's tubercle, I have told it is in between the second and third compartment. Okay. So there are two tendons clearly visible. It is oval shaped and there are two tendons. This is one and this is another. So these are the extensor carpi radialis longus, ECRL, and this is the extensor carpi radialis brevis. So we have found out the second compartment. Then where is the third compartment? Here is the third compartment sitting. You can see the glistening tendon, white tendon. So this is the extensor pollicis. Which one? Longus or brevis?
Longus.
Longus in third compartment. You have understood the things very well. I am very happy. So, and this next group of tendons is basically the fourth compartment. Okay. So, extensor digitorum and extensor pollicis. Now, I'll be moving towards the radial side. So, let's clear the drawings and move towards the, we are moving now towards the, so we can see the Lister's tubercle still, but Lister's tubercle now is going to the side and just below the yellow dot. Now we have clearly two tendons, that is the extensor carpi radialis longus and brevis. Now we are going further towards the radial side. Now we can see another two tendons. Now at this point, it is becoming a little bit difficult to distinguish both the tendons. We can see the styloid. Just, you can see the styloid, I think, just below the yellow dot. I will draw. Just below the yellow dot. Can everyone see the styloid?
Yes.
Okay. If we go further lateral, we'll be seeing a cephalic vein that we can easily compress, and at this point, if we go slightly proximal, we'll be able to see distinctly these two tendons. Okay, so these are the abductor pollicis longus and extensor pollicis brevis. So freeze karo, abductor pollicis longus, this is the extensor pollicis brevis. Okay, so if there is fluid accumulation here close to these tendons, then will be actually, this is the condition known as the dequervance tenosynovitis. And now you all we know the name of the test, clinical test that we do for the dequervance tenosynovitis. Can anyone tell?
Finkelstein.
Yes.
Finkelstein.
Yes, Finkelstein's test. Now, if we go slightly towards more proximal side, now we can see a black dot. Just. Yes. So can everyone see one black dot is here below? And that is here at this point. Okay, I'm going proximal, then it is at this point. Let me draw at this point. Okay, as I'm coming, I'm taking it slightly towards the distal side, and I have to orient it slightly in short axis of that structure. So see, that structure is coming and crossing the compartment 1. At this point, it is just crossing over the compartment 1. So what is this honeycomb structure?
Superficial sensory branch.
This is the superficial branch of the radial nerve. So we have to be careful, as I told, during the injection for the compartment 1, we should not injure that nerve, neither during the surgery. Now again compartment 1 to compartment 2, then we will be having the here we will be having the Lister's tubercle as well. Okay, so we have understood the compartment 1, we have understood the compartment 2, and we have understood the compartment 3 just below the yellow dot. Can everyone see the compartment 3? Then we are having this is the compartment 4. So in the compartment 4 is a large compartment. Basically 4 tendons are there of the extensor digitorum, and see at this point we can see the extensor digitorum tendons in a very good way. And if we go slightly proximal, because extensor indicis is there, as I told, it is mostly muscular in the proximal area. So you see one is becoming muscular. See here all are tendons. Okay, the lower portion, you see all are tendons at this point. They are all hyperechoic. But as I'm making it slightly close, you see some part below becoming muscular. And this whole hyperechoic area is the fourth compartment. After the fourth compartment, we have the joint. Just above the joint, we have another tendon. This is the compartment 4, and this is the muscular portion, okay, of the indicis. So this is the compartment 5. Okay, and which tendon is this?
EDM, digiti minimi.
Yes, extensor digiti minimi. So how we can understand it is the extensor digiti minimi? We can. Now the patient is moving the little finger and see this is moving. Can you see the moving finger?
Yes, sir.
So there is no doubt this is the extensor digiti minimi. After the extensor digiti minimi, the styloid. You see, there is the bone. And as we go further, we can see another tendon. Okay, so here is the styloid process, ulnar styloid. Here we have the joint and compartment 5 just under the yellow dot. As we go further lateral, we have the extensor carpi ulnaris. Okay, so this is the our 6th compartment. Now we have understood all the tendons at this point.